let's talk about the last condition for today. That is pulmonary embolism. Actually, pulmonary embolism, which involves a series of hemodynamic, respiratory, inflammatory responses as a result now of an obstruction within now the pulmonary arterial circulation. So you'll find that now there's obstruction to the pulmonary artery or one of the branches of the pulmonary artery by a thrombi or a thrombus that has just originated from somewhere else in the venous system, or sometimes originates from the right side of the heart. So what causes pulmonary embolism? Thrombus, you have said there's been trauma, surgery, hypercoagulability, heart failure, pregnancy. All this still will lead to formation of a thrombus. So what happens with pulmonary embolism? So when a thrombus has formed and then somewhere else in the venous system, now it goes to the pulmonary artery, it will either completely or partially obstruct pulmonary artery or any of it, the branches of the pulmonary artery. And that means that now there'll be alveolar lead space will be created. And this is because now there is little or no blood flow taking place because of that obstruction. And that's going to impair gas exchange, or there'll be no gas exchange taking place at all, more especially if it is a complete obstruction. So that's going to affect the gaseous exchange from taking place. And remember that now we talk about the pulmonary artery. If you go back to your anatomy, this is a major blood vessel and within the circulatory system. And remember, the pulmonary artery now is the one that is carrying deoxygenated blood from the right ventricle of the heart to the lungs for oxygenation. So in this case now, once an emboli now is has obstructed this, then it means that little or no blood is getting to the lungs for oxygenation. So that's going to impair the process of oxygenation. So in addition now, of the various components that will be released from the clot that has formed and obstructed, it's going to cause now the regional blood vessels and the bronchioles to constrict, and that's going to affect or create an imbalance between ventilation, a ventilation perfusion imbalance, because now there is less blood that is coming in for oxygenation. That means that now ventilation is not taking place, and that means that the body tissues are now not being perfused sufficiently as it should. There will also be an increase in pulmonary arterial pressure, because now that blockage is going to increase pressure within the pulmonary artery. So there will be an increase in pulmonary arterial pressure, and that's going to increase now the right ventricular work, just to try to maintain pulmonary blood flow. Because now with that blockage, blood is not flowing or is flowing in less amounts. That means now the right side of the heart, the right outcome, the right ventricle through which now the blood goes into the pulmonary artery, their workload will be increased, trying to push blood to pass through that emboli that is clogged in the pulmonary artery to get to the lungs. So if the right ventricles now overwork in accent that they are not able to, or it exceeds their capacity, then they are going to fail, we are going to have what we refer to as right ventricular failure. And that means now there will be a decrease in cardiac output, which now will lead to a decrease in systemic blood pressure, and patient will go into shock. Because remember, if you think about blood flow, it comes in to the right ventricle, goes to the pulmonary artery, gets into the lungs, it's oxygenated, comes into the left ventricle as it goes into the body. Now, with the pulmonary artery now being blocked, you see now that has led, now if you think of it backwards, you think of the right ventricle, it will fail because of the exceeding pressure. That means now if it fails, as it tries to overwork to push blood, it fails. It means now it will not be able to push blood, no longer be able to push blood through the pulmonary artery where the thrombi has clogged. That means less blood is getting to the lungs for oxygenation. That means now less blood is getting into the left ventricle, and that's why we are going to have decreased cardiac output, because there's less blood getting into the left ventricle. So if you think about the signs and symptoms, you'll think about the signs and symptoms that will come in before where the thrombi clogged, and even after from the pulmonary artery. You'll think of less blood is getting to the lungs for oxygenation. There's decreased cardiac output. What's going to happen? So body tissues will receive insufficient of the oxygenated blood. So cyanosis, dyspnea will come in, and eventually patient will go into shock. Some of those risk factors associated with pulmonary embolism or an emboli: venous stasis, that is slowing of blood in the veins; prolonged immobilization, more especially post-operatively, very common; prolonged periods of sitting; the varicose veins; spinal cord injury; hypercoagulability, that's release of tissue thromboplastin after injury. Could be as a result of injury. Sometimes people have fractures and out of a fracture an emboli forms, and it travels into the pulmonary artery and it clogs that. I lost a friend just recently, like 2-3 weeks, as a result of this injury. A blood clot formed, traveled up the veins, got into the pulmonary artery, blocked that, into shock. Tumors, increased platelet counts can all be sources of an emboli forming. Certain diseases, heart diseases, trauma can all be causes for an emboli forming. Advanced age, obesity, oral contraceptive use, history of previous thrombophlebitis, pulmonary embolism can all be risk factors for formation of an emboli. So clinical manifestation: dyspnea, which is the most common; chest pains, anxiety, tachypnea, cough; diaphoresis, that is excessive sweating; hemoptysis, coughing up of blood; syncope, or referred to as fainting, will come in. How to diagnose and assess and diagnose? Of course, you look at the ventilation perfusion scan, will show that there's an imbalance in that. Pulmonary angiography, though we'll come to this later on in the medical surgical nursing, but still just for the mention. The ECG, the electrocardiogram, which will show you that there will be regular electrical activities in the heart. Doppler ultrasonography, which will show you still again the the electrical activity is changed within the heart. So how do we prevent pulmonary embolism? Active leg exercises should be advised for patients, more especially those with increased risk factors that we've just mentioned. Using the compression devices, as the pneumatic leg compression device, which reduces the venous stasis; elastic compression stockings, which again will now minimize the risk of thrombi forming; anticoagulant therapy. no, we'll not talk about the management. Let's just, this one, just ignore the rest of the notes that are talking about management. We'll come to that later on. Any question from that point up to that point? Just leave alone the element of management. This one will come in other notes. Swali? Let me check if there is one. Crispin has raised his hand. Yes, Crispin.
So good morning.
Yes, good morning.
So my question is, how is this pulmonary embolism diagnosed?
How is pulmonary embolism diagnosed? It was just right here. It's not that I just told you that it may not be for us right now. But it's, let me just take you to the diagnosis. The diagnosis, you can see there, you can do a perfusion, a ventilation perfusion scan, which shows that there is an imbalance in perfusion. You can do pulmonary angiography. Talk about angiography. Just angiography is just to visualize. It's a medical imaging technique which allows you to visualize the inside of blood vessels and organs of the body. So you visualize the pulmonary artery, so you are able to see the emboli, where it has formed and where it has clogged. A chest X-ray, which will still just try to evaluate the lungs because now there is insufficient oxygen getting to the body. The electrocardiogram, which I've just talked about here, which will show you the electrical activities of the heart. All this, the peripheral vascular studies, arterial blood gas analysis. So the diagnosis will always be dependent so much on how the clinical presentation of the patient. That will inform you the type of diagnostic procedure you could want to utilize for that particular patient. Another question? How does immobility contribute to pulmonary embolism? Anybody could want to try that before I answer? How does immobility contribute to pulmonary embolism? Anybody who wants to try? Now, with immobility, like we said, it's a risk factor, and actually a major risk factor for that case. It contributes to pulmonary embolism because now immobility can easily lead to formation of blood clots, more especially in those deep veins of the legs, where we talk about this. I know we'll be talking about deep vein thrombosis later on. So with immobility, it increases the risk of formation of blood clots, more especially now in those patients with deep vein thrombosis or who have a risk of developing deep vein thrombosis. If those clots get to form, a part of the clot can break off, or the whole clot, then it's going to travel through the bloodstream to the pulmonary arteries, and that's going to lead to pulmonary embolism.